The Ministry of Health on Thursday officially launched the National Commission on Disability (NCD) Accessibility Handbook. Minister of Health Dr. Frank Anthony expressed hope that the handbook would serve as a guide to encourage the necessary changes to ensure greater inclusivity for persons living with disabilities.
We have seen very slow adaptation of buildings trying to adapt to the needs of persons with disabilities.
He also pointed out that the ministry has observed a rise in amputations linked to diabetes complications, underscoring the need to address this issue to reduce the demand for prosthetics.
So if we address that properly, then we reduce the amount of people coming in needing prostheses.
Meanwhile, Guyana Singh, chairman of the National Commission on Disability, underscored that accessibility is not a privilege but a fundamental right. He noted that as Guyana advances as a developing nation, opportunities for persons with disabilities must include access to education and training, elements that are impossible without addressing accessibility challenges.
We need the necessary measures to be in place to force people to ensure that buildings that are for public access are accessible to persons with disabilities, because it's a cross-cutting issue.
Dr. Ariane Mangar, Director of the Disability and Rehabilitation Services, in providing a review of the handbook, stated that persons with disabilities face numerous physical and systemic barriers that limit equal access. She emphasized that the handbook is more than a set of guidelines, but rather a transformative blueprint for creating an environment that fosters inclusivity.
And it's our hope that as we progress, much of the suggestions in the handbook are taken into account when erecting new structures that empower everyone, including persons with disabilities.
Tiana Cole reporting for the HGP Nightly News.